Bring in Art Mirelez. How's it going, Doctor?
Doing fantastic.
Nice to see you. Now, you've been on vacation.
Well, you know, we got to get a little break every now and then.
Do you guys take a vacation every holiday?
It's the only time of the year that we actually got to, get 2 weeks off. And favorite time of the year.
What does Dr. Art Mirelez do on vacation?
Well, you know what? We every winter break we go out to Shaver, and we rent a little cabin and we invite some friends, and the kids have a great time. And no, I called you.
Oh, okay.
Yeah, you didn't get the message?
I called your office. That's how I found out you'd be out till January 5th. I'm glad you got some time to take off with the family.
Yeah.
But I'm also glad to have you back to talk about your wellness and some of the things that you've been telling me about. I mean, you're a dentist, and I had no idea that the dental problems could lead to so many different health problems. Right. And the more I talk to you, I'm thinking, oh my gosh, did some of my health problems in 2014, could it have been caused by the mouth?
Yep. Yeah, it's interesting. More and more studies are coming out showing that the health of your body is related to the health of your mouth. And as I had mentioned to you before, when you mentioned to me that you had a stroke, anytime a patient comes into my office and gives us a history of heart disease or stroke or anything to that effect, the first thing that comes to mind is, okay, we got to check to make sure this patient doesn't have gum disease. Because gum disease has been a better predictor of heart disease based on the fact if somebody has missing teeth and gum disease. So those are better predictors these days than cholesterol, high cholesterol. So
is it going down the throat to the heart, or is it going into the bloodstream from the mouth to the heart? What's going on?
So we all have bacteria in our mouth. We have good bacteria and bad bacteria.
And everybody has both.
Everybody has both,
right,
but to different levels, right? But the way heart disease is affected is that the bacteria gets into your carotid artery and it clogs up. It creates blood clots in that area. Those blood clots can float throughout your body, and then you end up with a stroke. And so it is our mission and our goal to not just fix teeth. We do fix teeth. But our main goal is health and wellness, and we're looking to improve the quality of life of our patients by educating them.
Now, let's talk about me personally here for a minute, because, that's one of my favorite things to do. Of
course. Most people like talking about this.
Right. Okay, so I have the artery next to my cerebellum blows out a flap, is what they called it, and blood pouring into my brain causes me to have 3 strokes, boom, 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 one morning, June 11th. So could that be caused by a bad mouth?
So an unhealthy mouth that has gum disease can definitely contribute to a stroke. So the answer is yes. So I know that you've been trying to get into my office, so we're going to get you in really soon. But one of the things we're going to look at very intensely is to make sure that there is no gum disease in there. Because people have gum disease to different levels. But the bottom line is if you have gum disease. Now, gum disease...
How many people have gum diase?
75%.
75% of people have gum disease.
Of some sort, yes. And to different degrees.
How many of it's... what's the percentage of the 75% that's treatable?
100% of it is treatable.
Nice.
Yeah. Now, what we do in our office is we try to stop the gum disease, and we do that by various means. So number one, first and foremost, it's cheap, right? It's educating our patients. Making sure that they understand their susceptibility. The risk factors is what we call it. So the way you can think of it is that a lot of gum problems and teeth problems and just health in general is genetically based. And so when it's genetically based, there's only so much we can do. But let's just say, for instance, you are at risk for a heart attack. What does your doctor say? Don't smoke. That's a risk factor. Lose some weight. Eat healthy. So those are risk factors that even if your mom and dad both had a history of heart disease and stroke, we're going to tell you, hey, these are your risk factors. You can control the risk level if you control this. So that's what we do in dentistry. We say, look, you have gum disease. We want to make sure that we try to lower your risk factors by doing things such as visiting us every 3 to 4 months, by controlling the gum disease by flossing and all those other things. But in addition to that, we have treatment. And our treatment, we really try to keep it very minimally invasive. If you talk to people that have gum treatment in the past, they'll give you some horror stories.
Like it hurts.
Like it hurts.
Like
yep.
like I walked away with pain that didn't go away
Exactly.
for weeks.
Exactly. And those are the type of things that we hear all the time. In our office, we really focus on minimally invasive dentistry. And what that is in our office is we've been utilizing the laser for about 7 to 8 years. Very minimally invasive, especially with anesthetic. And patients walk out, go to work, maybe an ibuprofen, and they're good to go.
What kind of work can a laser do?
So what lasers do is that the cause of gum disease is the way our body reacts to the bacteria in our mouth. So we all have immune systems that work to different degrees. Some are very, very reactive. Some are not as reactive. But if you have an inflammatory process in your body that's very reactive, just a small amount of bacteria can cause things to go awry. So what we do is we use a laser in addition to conventional things like scaling and root planing. That's going underneath and really cleaning it out. But the laser, what it does is it removes all the bad tissue that's underneath the gums.
Okay.
It kills bacteria.
Does it hurt?
It doesn't hurt because you're numb, and it's just a very, very tiny probe that we stick underneath the gums.
It's a little laser beam.
It's very, we're not talking about
a
bazooka.
A lightsaber.
No. So it's very small. It's less than the thickness of the point of a pin, And so what that does is it removes the bad tissue, and it also promotes regeneration of new tissue, and
really?
It kills the bacteria.
Okay.
Yeah. Now, we take it a step further that we've been implementing for the last 5 years is we use ozone technology. So ozone, what it does is it kills bacteria, viruses, and fungus. So whatever the laser doesn't remove, we use ozone in the forms of gas, water, and air. Gas, water, and cream underneath the gums to eradicate whatever's left as far as bacteria.
Wow.
And we've had great success, absolutely fantastic success. So we don't even send our patients out to get this gum surgery that most people are doing because our success rate is so high in our office.
Well, so you're taking this cosmetic surgery and regular dentistry and kind of blending it together with new techniques.
Exactly. So, it is better for the patient if we take a wellness approach to their dental health. And I always tell people, if you are treating patients to minimize the risk for problems, the side effect is a beautiful smile, right? If you have somebody that doesn't have a beautiful smile, chances are they have some other things going on. And so our focus is the health and wellness of our patients. And as a result of treating that, then you end up with a beautiful smile when we're all said and done with.
And confidence.
And confidence, that's right.
Now, don't you have something coming up?
We do. We have, and actually, what I started to sense and feel is that I would get patients that were calling and inquiring about dental implants. Dental implants is something in dentistry right now that can really rejuvenate somebody's quality of life. And I always tell people that your teeth should be in your mouth, not in a jar. So if they're in a jar as a result of having dentures or just missing teeth, then there's treatment available. And so we were getting a lot of questions, patients coming in for consultations. We put information on our website. But what we thought is, why don't we have a public free dental implant seminar? And it's absolutely free, no obligation. And the whole idea is to just get people in and educate them about what are dental implants. How can we help you? Do you need 1 implant? Do you need 3 implants? Do you need 10 implants? What is the success rate?
What do you have now? Right?
Yeah, exactly.
That we can replace it with something better.
Right, exactly. Because a dental implant is the only thing that can stop bone loss. There's only 2 ways of stopping bone loss in the face and in the mouth. So when patients don't have their dentures in, what do they look like? Show us. What do those? Exactly. That's what they look like. So they look something like that is because their bone deteriorates. It just melts away. So there's only 2 ways of stopping bone loss in the mouth, and that's a dental implant or a bullet.
Or a bullet. Oh, man, I'll never forget the time I went out drinking with my Aunt Barbara.
Yeah.
And the next morning, she had lost her teeth.
Oh.
Uh-oh.
Yeah, it was a horrible morning.
Did you have any?
I walked around like that. I got my teeth.
Well, yeah, let's keep the teeth in the mouth.
Yeah.
You know.
And let's go to the seminar that you have right here. Where's it going to be?
So it's going to be at our office, and it's going to be an opportunity for us to present what dental implants are, how they can help you, what are the different options, what are the costs, what are the payment options that we have in our office, and ultimately how can we improve your quality of life. And we're going to splurge, and we're going to feed our attendees.
Nice.
Give them some good food and drink, and educate them. And I want them to get to know what exactly their options are. And at the very end of the day, if that's all they get is learning about their options, then we're happy.
And a free meal.
And a free meal. Exactly.
You're right across the street from Bullard High on Palm.
That's right.
What's the address?
It is 5492 North Palm Avenue, and we are in the Fig Garden. And we're looking forward to seeing you soon, Chuck.
I'm looking forward to seeing you guys, too. What's the phone number over there?
The office phone number is 435-3113, and you can call us anytime, and we'll get you taken care
of. And just so people know, it's not as expensive as you might think.
That's right. That's right. You know, the other thing is we make dentistry affordable. So not many people can go out and buy a $30,000 car cash, but patients can make payments. And so dentistry, you know, it is what it is. It's costly, but we make it more affordable for people that really, really want to improve their quality of life.
You can buy a new car, but that's going to go down in value. You know what doesn't go down in value? A great smile.
And your health.
All right.
And your health.
Doctor, Happy New Year's to you.
Thank you very much.
Always good to see you.
Same here.
Hey, we're going to take a quick commercial break and stick around.